Good morning, everybody. If we could all take a seat and get started. Try to do things right on time, and we're kicking off at 8:30 a.m., ready to go for a day and a half. My name is Mike Lawlor. I work for Governor Dan Malloy in Connecticut. I'm his criminal justice advisor. Connecticut, as you might know, is a small state, but in many ways it's a big county. We have no county government, and so jail issues are handled through our State Department of Correction. We have a team here from Connecticut, and we're very happy to be participating. I also chair the board of directors for the Council of State Governments Justice Center, one of the 3 sponsoring organizations of today's Stepping Up gathering. Very briefly, to set the stage, we know that we are gathering in an extraordinary moment in our country. Democrats and Republicans, left and right, big cities, small towns, all acknowledge the need for comprehensive criminal justice reform. And increasingly in recent years, people have focused on our issue, the prevalence of persons with serious mental illness in local jails. And while the solutions are complicated, I think all of you who work on the front lines know that these are doable if we can get people on the same page, focus the resources where they will get the best outcomes. And it's really our job to spread that message in our local communities. So translating what we know to be best practices into concrete goals and concrete outcomes is the challenge. I think my state and your counties have made extraordinary progress, and your participation here is evidence of that. But we have a lot we need to do. And I think every single person in this room would acknowledge that the mere fact that there are so many persons with serious mental illness sitting in our local jails around the country is, in reality, a national tragedy. So stepping up. What is this all about? Our leadership at the Justice Center, together with NACO and the American Psychiatric Association Foundation, have had a lot of meetings over the last year to plan this get-together. You know, it was almost a year ago that we kicked off the Stepping Off initiative. Got a lot of favorable media coverage, a lot of positive feedback. I don't know if your community is like mine, but people acknowledge the importance of this and asked how they can be helpful. So we've made a lot of progress and have a fair amount of momentum at the moment. 250 counties around the country have actually passed resolutions embracing the goals of Stepping Up, and that spans 41 states. And believe it or not, those localities, if you added it all up, represent about 100 million residents of our country. Almost a third of the nation's population are already, in a formal way, invested in the goals that we all share. So you guys, and I like to think myself and those of us from Connecticut, are special, right? We invited counties around the country to apply to participate here. There was 200 applications from counties who said that they were ready, willing, and able to double down on their efforts to reduce the number of persons with mental illness in local jails. And of those 200 extraordinary applications, 50 were selected, and we are that 50. So we're special. And I think part of the reason you were selected is not just that you had made great progress, but you and we are accepting a challenge to do better, right? It's one thing to have a good plan. It's one thing to acknowledge what the problem is, but it's quite another to set goals, which will be measured over time, about whether or not we can actually reduce the number or the percentage of persons in jail with serious mental illness. That's our goal. And you know that just reducing the number is not a goal in and of itself, right? It's one measurement. But it's also our challenge to find resources in the community to which people can be diverted or sent in the first place, right? This is a real challenge. I don't know about where you are, but in my state, we're facing an extraordinary budget deficit. We are reducing services across the board. And so our challenge is, how do we allocate these reductions? How do we reallocate resources we have to achieve the goals that we're talking about here today? So this is a moment of great opportunity, but it's also one that has quite a few obstacles in the way. So our gathering has attracted a lot of attention here in the nation's capital, right? It's hard to do that. It's hard to do something here where people say, wow, I want to be part of that, and we expect over the course of today and tomorrow, we'll see some very high-ranking national political leaders joining us. Now, as you can imagine, the schedules get way complicated here, but we expect perhaps Senator John Cornyn from Texas, Senator Al Franken from Minnesota, and Valerie Jarrett, who, if you know anything about how the White House operates, you know that Valerie is a key policymaker, a key advocate for these issues with President Obama, and we expect that they might be able to stop by. They're hoping to stop by, as well as some very high-ranking people from the Justice Department. So when they arrive, of course, we'll interrupt the proceedings and let them speak to us, and I think we can take this as an opportunity to show them how ambitious we are and how enthusiastic we are about achieving these goals. So what's our objective here in a day and a half? Each community, and in our case our state, is here to develop a plan, right? A realistic plan which we're prepared to go home and attempt to implement. You will have the opportunity, I'm sure you've seen the agenda, to see and hear from the leading experts in the country about these issues. And so I know a lot about politics and stuff in my state, and I know a little bit about how to make things happen, but I don't know about the technicalities that are necessary to make progress. And we're going to learn best practices and worst practices from around the country so we can do the things that work and stop doing the things that make it worse. Our partners in this, NACO, the American Psychiatric Association Foundation, the Bureau of Justice Assistance at DOJ have been extraordinarily helpful to us in Connecticut, I'm sure to you around the country, in achieving these goals. Also, a major partner is the MacArthur Foundation. Connecticut was fortunate to get one of their safety and justice grants to help reduce the jail population generally. You'll see Lori Garducki will be here tomorrow to speak and talk about that initiative. We have partners around the country, National Alliance for the Mental Illness, Major County Sheriff's Association, the National Association of State Mental Health Program Directors, the Policy Research Associates, the National Council on Behavioral Health Care, the National Association of State and Alcohol Drug Abuse Directors, the National Association of County Behavioral Health and Developmental Disability Directors. And, you know, it's hard to get all these people on the same page at the same time. This is a real challenge. Mental health folks, criminal justice folks, and I think that's why we have this great opportunity. Finally, some housekeeping details. Today, we didn't get a breakfast, but we're getting a lunch, right? Just so you know, we're going to get a lunch provided to us so we can maintain the momentum. At the end of the afternoon, from 4:15 to 5:15, the hope is that each county team will gather together to take stock of what's happened during the day. We've got breakout rooms that have been assigned for that purpose. You can see those in your materials. All of us are invited to an Apex Awards dinner tonight, so get free dinner too, that's good. But I think we'll have an opportunity to see some real national leaders at that event. You can, if you're into social media like I am, you can download the Stepping Up Summit app on your smartphones, right? You can follow the proceedings and do as I did a few minutes ago, put it on my Facebook page and ask my friends in Connecticut to follow along these proceedings live, because you can do it online. And finally, there is a photo booth outside. You know, you're all kind of celebrities in your own way. You can stand in front of the screen that says Stepping Up and have your photos taken and share that at home, encouraging everyone to do that. So let me introduce someone who is definitely a very important person in the world that we are entering. Dr. Saul Levin is the CEO and medical director for the American Psychiatric Association. And I can say for my part, doing criminal justice policy, APA has been such a critical partner in spreading the word among criminal justice folks about the importance of all of the things we're talking about here today. And Dr. Levin has really led that charge. Along with his duties at APA, he also serves as the chair of the American Psychiatric Association Foundation, who without their help, we would not be gathered here today. And he himself has a long and distinguished career in healthcare, both in public and private sector, and he did spend a time, kind of like one of us, on the local government level as director of Washington, D.C.'s Department of Health. So with that, let me introduce Dr. Saul Levin.
Thank you, Mike. Much appreciated on the introduction. So I think what we're actually going to see on this panel today is, since we've brought together three amazing organizations, so we each have to talk in some ways to not only the program we're going to be doing today, but also to our constituencies in the room. So if we repeat a little, forgive us. I think we're trying to sort of make sure that we all work to the common goal that has brought us all here. So I start by saying welcome to Washington, D.C. You could not have got a better weekend or a better 2 days here. It is truly what makes Washington, D.C. wonderful in the spring. So if you do have some time, do a little bit of work-life balance and go and take a walk around the area, see a little bit of the cherry trees that are still in bloom. I'm humbled at the turnout here today. It is truly amazing to see who has come and how committed you all are. Last night at the reception, I had the opportunity to talk to some of you here, not all, and it was truly amazing to hear your commitment to the issue of how do we ensure that the criminal justice system and the mental health system come together for the betterment of not just the criminal justice system, but also for our patients that we serve as psychiatrists. There are more than 450 mental health professionals and community leaders from 50 jurisdictions in 37 states here that came for the summit, and it's a testament to the spirit of collaboration that is the heartbeat of all successful advocacy work that goes on in Washington, D.C., sometimes successfully, sometimes not successfully. The fact that you've all come together and we've come together, I'm hoping that this is a start of a, what's that immortal words out of the movie, oh, now I'm going to block on it. This is going to be a long-term friendship. You know, we're starting a good friendship here. Casablanca, correct. It's, you know, that's when people start getting nervous on my staff. Saul, stop ad-libbing. Keep to the script, right? Yeah. I want to take a moment to acknowledge our partner organizations who made this summit possible. I'd like to thank the National Association of Counties, NACO, with the leadership of Honorable Sallie Clark and Matt Chase, as well as the Council of State Governments Justice Center, a staff under the direction of Mike Lawlor, Mike Thompson, and my good friend and colleague, Dr. Fred Osher, and me and him go back many, many years, all the way to what was then Adam Haar, now SAMHSA. So it's wonderful to see him as being so much part of the leadership and being able to represent us, you know, at the State Government's Justice Center. And for collaborating with the APA and the APAF to make the summit a reality, of being partners and stepping up organizations. I had the wonderful opportunity of presenting on the steps of the Capitol when we first launched Stepping Up, and I'm hoping that that will not be the last of it. I'd like to thank the APA Foundation team who organized the summit, Judge Leifman, standing at the back. Judge, you know. We have the wonderful pleasure of having the judge sit on the APAF board of directors as the public member on the board, and he has really brought great calmness to the board, but also great knowledge, and particularly in this area. And I have to really, if I had a hat, I'd take it off to you, sir, because it was his expertise, and he's constantly saying, we hear from the mental health community that something needs to be done. I'm here to help you do it, and we have to congratulate him also on winning the William Rehnquist Award that he received a few months ago in the Supreme Court. So congratulations on that, and this would not have happened had it not been for you. Right. We also have the Apex Award tonight. We have the Apex Awards tonight. So for those of you who are already wearing orange, as you know, if you come into the dinner, we ask that you do orange being the new black, which is part of the theme of that dinner. Don't worry, all of us are going to be turning into orange, as we get closer to that dinner. So don't feel bad if you've already started to wear orange. It's appreciated. I have to thank the Apex team of the staff, Paul Burke again, for his amazing leadership, both at the Foundation and at the Apex Awards, Kimberly O'Donnell, Lindsay McClenathan, Dewey Newen, and Crystal Rucker, and the new member of the team, Molly Whalen, who helped put that Apex dinner together. I also have to thank Jason Young, my Director of Communications, and his team for the Stepping Up event and the Apex event tonight that will be filled. This leads me to recognition of our National Summit sponsors for their generosity and commitment to the issue. The summit would not have been possible without them. Janssen Pharmaceutical Companies of Johnson & Johnson, the Elizabeth K. Dollar Trust, Alchemies, Otsuka America Pharmaceutical Company. And I also have to thank Dr. Marsha Goyen, sitting here in the front as part of the California County, who was a past president, for also being a leader in this area over all the years that she's been at APA and working in the community. Thank you. I have also one of my board members and secretary, Altha Stewart. She was sitting just there a minute ago. Where did Altha go? Oh, there she is now, who is not only part of the county team, and we really have to thank her. She walks the walk and talks the talk every day on the work that you all are going to be doing and we are doing, but also for sitting on my board. And she actually was the president of the American Psychiatric Foundation before we constituted the new foundation and led it to its success of what we are doing today. I firmly believe that with the Stepping Up campaign and the partnership of the state and local officials, the criminal justice informant officers, psychiatrists, and mental health, that we have a chance to begin to bend the curve down of admissions to the jails and prisons and create a prevention, early intervention, treatment, and recovery system of care that will help people who live with mental illness for not being further stigmatized and incarcerated, but they have the opportunity to receive care that they need and deserve. From a country like ours, which is so blessed with resources, they just need to be realigned. I want to thank you all for coming, and I'd now like to introduce Dr. Renée Binder, the president of the American Psychiatric Association. She also was, as president-elect, sat on the APA Foundation board, and she will be returning to that board when her term ends in May, and she then comes back onto the foundation board as past president. Dr. Binder is a professor of psychiatry, the founding director of the Psychiatry and the Law program at the University of California, San Francisco School of Medicine, where she's also an associate dean for academic affairs. She's a forensic psychiatrist who has wholeheartedly supported the initiative from the start, and someone I'm privileged to have had the opportunity to work very closely with as president this year, and I'm looking forward to continuing working with her. Dr. Binder.
Good morning, everyone. This is just an incredible meeting. I mean, if everyone looks around, we have all of these counties involved. We have different disciplines involved. And I remember when I first heard about this, we were at a foundation and talking to Judge Leifman and Paul Burke and Sullivan, and we started to talk about having this summit. And now that we actually have it, that was almost 2 years ago that we were talking about it. So thank you everyone for coming and for participating in this. So as president of the APA, different people have different themes, and one of my themes for this year has been criminalization of people with mental illness. And as a psychiatrist, I realize that this problem is multifactorial. We have to approach it in different ways, but part of the solution is for psychiatrists to provide leadership in this area. And about a year ago when we launched the Stepping Up campaign. I was in Sacramento. I live and work in San Francisco, so I went up to Sacramento, and we were on the steps of the Capitol building, and there was an assembly member there, and there was Darrell Steinberg, who was part of it, who is now out of the assembly, and there was someone who spoke from the sheriff's department, and someone who spoke from probation, someone who works with juvenile justice, and it just occurred to me that everyone partnering together can really make a difference in this situation. As I'm sure everyone in this room knows, 2 million people who suffer from mental illness are booked into the jails, and in 44 each year, and in 44 states, including the District of Columbia, the largest public institution that houses people suffering from severe mental illness is a prison or a jail, and this is correlated with the decrease in the number of state hospital beds, that we still have the same individuals with serious mental illness, but we don't have enough psychiatric beds, and so they are moving from state hospitals to the jails and prisons. The same thing is true of Rikers Island in New York, LA County Jail in Los Angeles. So each president has a retreat at the beginning of the year, and past presidents have gone to visit research labs, have gone to visit psychiatric hospitals, and so when it was in San Francisco, I took the Board of Trustees to visit San Quentin Prison. Many of the members of the Board of Trustees had never been inside a prison before. In fact, someone asked me if it was like Alcatraz, and it was a tourist attraction. I said, no. Yeah, it's not. And during the visit, we took a tour of the complex's 50-bed psychiatric hospital. The chief psychiatrist is one of my former fellows, and the San Quentin has an affiliation with the University of California, San Francisco. So the care there is actually pretty good, but that's the exception. It's not the rule. And as we know, the care in prisons and jails is often very poor. People who are incarcerated with mental illness stay behind bars longer than people with comparable sentences. They just don't know the rules about how to get out of jail. They're victimized, and they suffer higher recidivism rates. So you're all here today because you've seen firsthand the toll this crisis exacts in your own community. And you know that it's a problem that requires immediate action. And I know that I'm preaching to the choir because that's why we're all here. But as representing the American Psychiatric Association, I understand that collaboration between mental health professionals, between the justice system, between county and local leaders will be key to addressing this crisis and finding a lasting solution. So we'll do a lot here. I also wanted to mention about Judge Stephen Leifman. He received, as Dr. Levin said, he received the William Rehnquist Award. The award was given in the Supreme Court. So we all went up to a room, which usually is not open to the public, a very grand room, and Judge Leifman gave a very passionate speech how as a judge, he realized that he was dealing with psychiatric patients and that he had to decide where they went. And then Chief Justice Roberts spoke. And he also was addressing this issue of criminalization of people with mental illness. And I think everyone in the room thought that this was so terrific, that this is coming from the Chief Justice of the Supreme Court, and it was an honor for all of us to have Judge Leifman get this award, and then to have that happen, and now to have this conference, and then the Apex Awards tonight. I am really excited about it, really pleased, and I look forward to 2 days of wonderful work, trying to come up with solutions, going back to the counties, and really trying to make a difference in this problem. So thank you.
So as you know, we have 3 partners here: Council State Government's Justice Center, American Psychiatric Association Foundation, and third, and perhaps most important, and representing all of you, is the National Association of Counties. And I'm privileged to introduce Sallie Clark, who is a county commissioner from El Paso County, Colorado, which is Colorado Springs, right? I had to ask which city it was, and she is an extraordinary leader in this regard. She was first elected in 2004, and currently she has her Safe and Secure Counties initiative underway, and it is one of the few initiatives that links the many aspects of what we all know is so important. Not just criminal justice, not just public health services, not just public works and government's responsibilities in general, sees the interrelationship of all of these parts of the puzzle. So with that, let me introduce Commissioner Sallie Clark.
Well, you just gave my speech, so now thank you very much. This is incredibly a great honor, and I looked at the list of who's participating in this today, knowing that out of the 50 that are here, we had, what, 200 applications to be here today. So it shows an incredible interest in what we do. You know, I'm just really honored to be here today on behalf of NACO and the National Association of Counties. I also wanted to recognize we have several of our other officers here. Brian Deloge from Leon County, Florida. Brian, where are you? Our first, oh, he what? Oh, he just stepped out of the room. He's our first vice president, so he follows me. And then Roy Charles Brooks from Tarrant County, Texas, is our second vice president. Roy, where are you? There you are. Let's give them a hand. And then also to all of you who are here on behalf of counties nationwide, in addition to our NACO staff. Matt Chase, who's here, I know Nastasia, Megan, and the folks behind the scenes, as we've recognized, who really do the work. And so I just like to give them thanks with a little round of applause here. That would be great. So, you know, reducing mental illness in jails is a top priority. When I started in NACO as a newly assigned commissioner to the job in El Paso County, Colorado, I was able to join a steering committee. And so the first one I joined was the Justice and Public Safety Committee. And so I learned a lot about what was going on in our jails and in our law enforcement, emergency management, all of those pieces. But what consistently comes up is how are we going to deal with the folks who don't need to be in jail, but they need some different type of treatment. When it comes to stepping up, counties really are on the front lines. And whether your jail population's 20,000, 10,000, or 100 per day, it's still the same problem because everything is relative depending on what size of county you have. We are responsible every day for providing the treatment, supervision, and comprehensive services to millions of residents every day. And when you look at the prison population comparatively, we see 11 million people, we see really, you know, the 11 million folks through our jails every year at the county level as opposed to the prison system, which is around 2 to 3 million. So we're holding the major inmates that we're seeing in our local jails. We also see that as one of the largest liabilities that we hold because things happen in jails that are not good things. And that is one of the major concerns that we have. And our deputies aren't trained to deal with mental health issues. We invest $83 billion in health and community hospitals, $93 billion in justice and public safety each year, and county leaders know that treating people with mental illnesses and substance abuse disorders in appropriate settings is not only more cost effective, but is also leads to better outcomes. The problem is we need to have the data, and we need to know the right questions to ask. We're not professionals in mental health issues. We're not professionals necessarily in law enforcement and all the things that we oversee. And so for us, we want to make sure that we're asking the right questions. As NACO president, I created the Safe and Secure Counties Initiative because counties play a vital role in keeping America's communities safe and secure. And whether that's the judicial system and law enforcement, emergency management, to maintaining roads and bridges, it's all relevant to what we do. In my home of El Paso County, Colorado, we have stepped up to reduce the number of people with mental illnesses in jails. And I wanted to just quickly focus for a moment. We have one of our local judges who has a mental health court, and she's taken some grief for it because it's hard to convince others that it's the right thing to do. But in addition to our problem-solving courts, we have the mental health court that was established by Judge Deborah Gross. And basically, I wanted to just read, and I'm trying to find it here, just a little bit about someone who was recently released from the mental health court. The first graduate, a year and a half ago, the graduate was jailed for assaulting a police officer and being stopped for driving under the influence. Bipolar disorder appeared to exacerbate the situation. I thought it would be easier to go to jail, the graduate said. At Gross' request, the Gazette agreed not to print the participant's name nor identifying information. But such cases are common. And although training is improving, police officers often do not know how to spot mental illness, leading to a confrontation and severe felony charge. All in all, about 1 in 5 people in the El Paso County Jail suffer from a mental illness, said the sheriff's office who oversees the jail. But that only includes people whom deputies are aware of. The actual figure might be higher. The graduate before Gross vowed to change as well, promising to maintain a job, to have a house, and to be a better parent. I can't fix anyone, but I can fix myself. And those are the folks that we're trying to reach, those who want to go back into society, be productive adults, and not be caught in that jail system. Many other counties across the nation have stepped up and made significant changes, but we're just getting started. And counties of all sizes have a stake in this important issue. And I was impressed to see Kiowa County here from Colorado, my state, because Kiowa is not a big county, 1,400 people, I think, in your county. So small county, but still important in that we're here today to recognize counties of all size. So I just want to close by thanking the Council of State Governments, Justice Center, the American Psychiatric Association Foundation for their partnership and leadership on this issue and working with counties on this national effort. A special thanks to Stepping Up sponsors on making this event possible, and we're excited to learn more about how we can know the right questions to ask and actually work on fixing the problem. Thank you so much.
So that's the end of the